All right, welcome back to the Digital News Desk on this Tuesday. I think we're back everywhere. We're on the app, we're on the website. Yep, we're back on Facebook, and we are on our YouTube channel as well this morning. Now, we switched from breast cancer awareness to physical therapy because October is National Physical Therapy. Is it Physical Therapy Awareness or just Physical Therapy Month, Jackie? I'm not really sure.
It's both,
Both.
both.
There you go.
It's
Jackie
both.
Rodriguez joins us from Ruthe B Cowl Rehabilitation Center. Jackie, welcome back. How are you?
Doing great and enjoying this wonderful, finally fall weather, Ruben. And glad to be on.
Absolutely. We do not miss the 100-degree days, that's for sure. And we're even
Not
getting
at all.
some rain. So, Jackie, tell me about physical therapy and Ruthe B Cowl.
Sure. So the month of October, like you just mentioned, is National Physical Therapy Month and also awareness, because the main goal here is to bring awareness of the benefits of physical therapy. And Ruben, we've been here for almost 65 years, and as the pioneers of physical restoration, we feel like we are the ones to need to set up the pace in bringing awareness of these benefits that physical therapy provides.
Classify it for me. What do we talk about, or what are we talking about when we're talking about physical therapy?
Yeah, so physical therapy, of course, is a profession that is acknowledged nationwide, along with physical therapists, physical therapist assistants, and of course, physical therapy techs. What physical therapists do, and their assistant is help manage pain and chronic conditions. It sometimes avoids surgeries and prescription drugs, which is those opioids for painkillers. Early intervention of physical therapy for any of the disorders or illnesses will help definitely, even again, not having to go into surgeries. And physical therapist maximizes mobility and again improves the physical abilities and fitness as well.
Typically, what kind of a patient, who is going to need physical therapy? I know you've talked about people who may have just had surgery. What other kind of patient are you talking about when we're talking about physical therapy?
Well, people, for example, with different, and you know what, Ruben, I wanted to make sure that I touched on all of them. So, I made myself a little list because it's important. Disabilities, injuries, as you know, every day in our community, we go out and about and we're exposed to different things happening, not only accidents, but, also falls, things that that physical therapy benefits bring to individuals.
Absolutely. Now, Ruthe B Cowl Rehabilitation Center, Jackie, I know you've been on several times. We love having you on because Ruthe B Cowl is there for everyone, whether they have the ability to pay or not. And so that's extremely important. But kind of let's backtrack and tell everybody what Ruthe B Cowl Rehabilitation Center is for those who don't know.
Yeah, so as I mentioned at the beginning, we are the only outpatient facility that provides physical, occupational, speech therapy. The only ones that provide transportation throughout our community and local counties. So it is important to know that the Ruthe B Cowl Rehabilitation Center has the support of the community, United Way, local foundations, private donors. That is the only way we've been able to continue our mission, Ruben, to provide the therapy for those individuals that don't have monies to pay or even have insurance, but have those high deductibles or high co-pays. No one here at the center is turned away. And this is thanks to the community and your support. And of course, you all for having us on the program and asking, when we have fundraisers so that we can continue our mission. And so we're here Monday through Thursday. And Ruben, behind me is the Vector. It's as you know, we unveiled the Vector machine. It's a robotic ceiling mounted system that helps early intervention with physical therapy so that patients can have a better outcome sooner than later and go back to work sooner again than later.
Yeah.
So those are some of the things that there's a notion out there sometimes, well, what can a nonprofit offer versus a private? Well, thanks to the community support, we have the best state-of-the-art equipment, and paired with our doctoral staff and our therapists, we just can be able to give the outcome of physical therapy is amazing.
Talk about the Vector system and how has that gone? I know it's been you've had it on board there at Ruthe B Cowl for a few months now. Are people utilizing it, Jackie, or is the staff able to use that?
Yes, it's used daily. The great thing about it is that, you know, we every hour at least 2 or 3 patients are able to use it, and we are back to back on that. We've gotten different referrals. We've gotten great outcomes for our patients. Physicians are very happy and are referring patients to our facility so that patient, especially post surgery, it's so important that they can get that therapy that they need earlier without impacting, you know, the surgeries or the bones or the knees, because what this robotic system does, it captures you in a way where you feel secure and you're not limited, and you have the confidence knowing that you're not going to fall or trip or, you know, hurt yourself further. And that's one of the things that patients talk about when they come. They're afraid of falling and injuring themselves, you know, further.
Physical therapists are a special breed because, you know,
Strokes. Many people's lives change. You know, if it's going to be
you,
temporarily while they rehabilitate, or whether it's going to be for life.
to be able to
Abilities such as not being able to swallow, not being able to walk. Maybe now they need to relearn how to comb their hair, how to brush their teeth. Daily living skill that sometimes we take for granted, sometimes are taken away from them, either temporarily or permanently. So, and also financially, some of these people can't work anymore. So now they're facing, what am I going to do? How am I going to pay my bills? Who's going to help me, you know, put that ramp in the house so that I can use my wheelchair? We have a case manager, a social worker that can find you those resources.
Wow. And that's key, because the healing process it's a whole, you know, gamut of things. It's not just the physical body, it's the mental, the spiritual,
Psychological,
everything. Do you
emotional.
Do you work with stroke victims as well, Jackie?
That is correct. And, you know, Ruben, unfortunately, we're seeing this stroke victims, survivors getting younger and younger. You know, we've had them as young as 24, 25. You know, stress really is one of the number one factors of, you know, heart attacks or strokes. Because, you know, we live in a fast-paced life. We want to get a lot of things done in one day, and it does impact in many ways. And so what we have here, we specialize. Right now on board, we have 3 physical therapists. 2 of them are doctors of physical therapists, and of course we have speech pathologists, and we have just a rehab team, the best in South Texas, Ruben. I don't care who you talk to, they love it here. They love to come here. They know that we're here for them. And again, all the other resources that we help them with here internally.
You're really fulfilling the mission of what Ruthe B. Cowl had in mind, aren't you?
Yeah, well, we hope we are. And I think because of patient surveys, and, you know, one of the main thing for her, and we're following that legacy, is that
222431. Is that the right number, Jackie?
That is correct, Ruben. If I might just say one more thing, is that tomorrow we're going to have the mayor here at our center. We're going to proclaim Physical Therapy Month and acknowledge some of our staff that have been providing service to the community for over 24, 25 years. And also just to let the community know we're here to help. And you know, of anyone, please send them their way. And again, thank you for having us, Ruben, and always helping us provide the community with the information that we have here so that they can take advantage of our clinics. Today, as a matter of fact, we have a live clinic for children that are come in, and it's free to the community. We have therapists, specialists coming in from the UT Health Science Center. These are doctors and interns that come in and provide free clinics for our community.
Wow. And so the awareness proclamation is tomorrow, you said, Jackie?
Tomorrow at 11 here at the center. We're going to have refreshments, and we're going to be acknowledging our staff. It's important to acknowledge them. If you see a PT or a PT assistant